All right, hello everyone. Good morning. So today we will cover depression cases structures here. Okay, so they all follow the same structure, and every case I follow the same structure, so you don't have to be confused here. And I don't like people studying this case from like 20 or 50 pages because they study every single scenario as a separate case, which is totally wrong here. What you need to know, the structure, the guidelines, and you should be able to do it whatever the circumstances or whatever the story is. Okay, and you will understand that once we finish here. So depression cases here, the patient will be coming because he is or she is feeling low or depressed. Okay, this could be a postnatal depression, like if she's feeling depressed after having a baby. This could be someone after breaking up with his girlfriend, maybe someone after losing someone he loves, whatever the trigger is. So it is a depression case. So I will start with data gathering, and data gathering always starts with the presenting complaint. Okay, and how can you start with that? You start with an open question about the presenting complaint, and you need to listen to the golden minute from the patient. For example, Mr. Jack, how can I be of help today? Doctor, I feel low. Mr. Jack, can you please tell me more about that? So open question to listen to the golden minute. Don't jump to ask closed questions at all. Give the patient some time to help you. So we'll start with open question to explore the presenting complaint. After you do finish that, if the patient is not giving you enough in the story, you can screen for depression by 2 quick questions or 2 quick screening tool. In the last months, have you been feeling low or depressed? Mr. Jack, in the last months, have you lost interest in things you used to do? If the patient says yes to any of these 2 screening questions, so he is probably depressed, and you will need to go straight with the structure here. Okay, and then we'll finish our presenting complaint by asking about trigger if the patient didn't mention the trigger here. Mr. Jack, you mentioned you feel low for the last few months. Was there anything triggering that at all? That could be losing someone he loves, it could be maybe losing his job, having some traumatic episode in his life, whatever it is. Okay, by that you are finishing your presenting complaint in a very good way, and that should take 1 or 1.5 minutes maximum. Second step in every structure I use is closed questions to rule out red flags or differentials. Closed specific questions, so the answer will be yes or no. Okay, and in this area we'll focus on 2 things only: biological symptoms of depression and red flags. So what is biological symptom of depression? People who are depressed, they might have problem with appetite or eating, or maybe sleeping at night, or maybe concentration during the day. These are the common biological symptoms for depression or loss of sexual drive. Yeah. So Mr. Jack or Amy, how about your appetite? Are you eating and drinking okay? Yes, doctor, or no, doctor. How about sleeping at night? Are you able to concentrate during the day? So ask 2 or 3 closed questions about biological symptoms of depression. And then the second thing of closed questions is to rule out red flags. Red flags in this case or any case of depression are 2 things: harm, thoughts, and psychotic symptoms. And these are sensitive questions, so when you ask them, you might prefer using a third party style of questions so the patient doesn't feel embarrassed to answer you. For example, Amy, sometimes when people feel low or overwhelmed, they might have thoughts of self-harm or harming others. Was that ever the case with you? No, doctor. So now she will feel more at ease to answer you. Psychotic symptoms as well. Amy, sometimes when people have strong feelings or feeling overwhelmed, they might start to see or hear things which are not there. Did you ever have such thoughts at all? No, doctor. Or yes, doctor. Okay, so by that you are very good. Go ahead to the third step in data gathering, which is general well-being of the patient. How was the patient doing before today? Or what you like to call maftosa. I don't mind, but make it relevant to the problem. For example, don't ask about past medical history of hypertension or diabetes, or family history of diabetes or stroke. It's not relevant to the presenting complaint today, so make it relevant. Yeah, any known mental health problems at all. Did you have any depression or anxiety before? When you ask about medication, did you try anything? Are you taking any medication over the counter? For example, many people can use herbal medication to help with depression, like St. John's wort, and that can interact with SSRI if you will be giving it in management. Yeah, that's why it's relevant. Family history of mental health problems, that will make it relevant. And then you can finish with the lifestyle questions. Do you smoke at all? Do you drink alcohol at all? Do you have or do you take any drugs at all? Okay, and then we will finish data gathering as usual by 2 steps, and I always do them as long as I have a living human being as a patient, because that will make you as a doctor, because you are not a robot and you are treating a patient who is a human being. You're not treating a disease, so you need to ask Psychosocial and ICE to show that. And psychosocial means impact on life. Okay, why the patient came today? So let's ask this patient here. Amy, you told me you have these feelings for the last few months. How that has been affecting you? How that has been impacting you? Or maybe another example, what difficulties are you facing because of that? Okay, so you can choose any line you like, but ask psychosocial impact of the problem on the patient life, and the patient life will be work and home life. Okay, and you can check my IBS session. We have covered a lot of examples for that. And then ICE is important. Okay, so you can ask the patient about her ideas, concern and expectation. For example, concern, what is worrying you the most? She might be worried that she is not able to cope at home. She might be worried that she is not able to function at work. She might be worried that she might lose her job. So listen to the patient. Expectation, what are you hoping from today's consultation? Or maybe were you hoping for anything specific to try today? Or maybe have you given any thoughts, how can I help you today? So ask expectation, please. By that, you finished your data gathering. You have been holistic so far. Examination usually not needed. Okay, it's usually a counseling station. But if you think about organic or problem to cause an anxiety or depression, such as thyroid, if the patient has thyroid symptoms, you can offer examination here. But most of the time, we don't examine them. Investigation as well not needed. It's usually a counseling and a clinical diagnosis. Then give the patient a diagnosis in a simple way. Having listened to you, Amy, I think you're going through depression. Do you know what is depression? Do you know what we mean by depression? You need to give a diagnosis and explain it in a simple way. Okay, so you can say depression is when your low mood interferes with your life or interferes with your day-to-day activities, and I can see it has been really impacting you for the last few months. Yeah, it's usually triggered by an event. As we mentioned, this could be having a baby, could be losing a job, maybe losing someone you love. Okay, and then start your management. And in management, what you need to know is you should be sharing with the patient. Don't dictate. It's not a textbook. It's not a theoretical exam. You need to share with the patient. For example, Amy, we have a lot to help you with that. There are medical ways we can help you with and non-medical ways we can help you with. And then you can explain both. Or for example, Amy, some people with these feelings, they prefer to take medications to help to balance the happy hormone in their brain, and some people prefer trying something not medical, such as trying counseling or talking therapies, and some people prefer trying a mix of both. What do you think about yourself? So give patients option and share with her what does she like. Okay, if she says, for example, doctor, I would like to try counseling, so you can advise her that we can refer her, or she can self-refer for counseling therapies. Okay, so she can talk to a professional who can talk to her and can try to help her with her symptoms, or other non-medical options as well. If she can talk to friends or close family, she can go out, she can exercise, she can meditate, so you can talk about that. Or maybe she says, doctor, I would like to try medications. So for medications, we can offer you a medication which is antidepressant. It does try to balance the happy hormone in your brain. Will you be happy to try that? Yes, doctor, yeah. So if you start antidepressant, you need to counsel about them, that they do take time to kick in. So they do take time to achieve that balance. So we expect you to get some benefit within the coming 4 to 6 weeks. Yeah. And it's a type of medication that you should take for a long time. So we usually aim for 6 months after you feel back to normal. This is for first episode of depression. Yeah. Every medication comes with a side effect, and this medication, the type of medication that can cause you feel worse before you feel better. So if you have any self-harm thoughts with this medication or any side effect that's troubling you, please do call us back. Okay, indeed, I will finish every data gathering or every station with follow-up, safety netting and the leaflet, so you can show safe practice. And you usually follow people if we start them on medication within 1 week if they are young, or within 2 weeks if they are older than 30 when you start the medications. Yeah, because you need to review them. And then safety net about self-harm. Amy, if you ever have any thoughts of self-harm or if you feel unsafe, please do seek immediate help or do talk to crisis team. Crisis team is acute mental health service. The patient can call and they give them immediate or acute or quick assessment and help plan. Okay, I hope it does make sense. If you know that, this mind map should cover any depression case you might have in your life, in your exam, or in your real life. Okay, I hope it does make sense, and I hope it does help you. If you do that in 8 minutes, please get 12 out of 12 here. Okay, I will finish with a quick announcement. We have a mind map package which does include all the common stations that comes in OSCE exams, and every one of them is covered the same as the previous mind map. So in 5-10 minutes maximum, you know everything about the station, you know the guidelines, you know the relevant questions and the relevant structure. So it does have more than 220 mind maps similar to that. Okay, and it does have a playlist as well of cases simulations and the feedback on them, so you can watch them and you can reflect on your own selves. And it does have as well a playlist for writing sick notes and the medication in the hospital and the charts outside the hospital and end of life medication and respect forms as well. There is a group discount available. If you like to join, you all are very welcome. You can text me on that number on WhatsApp and you can get more details here. I hope you found it useful, and you shouldn't be afraid from any depression case, because it is a chance for getting 12 out of 12, and you can study this station from only this slide in these 5-10 minutes only. You don't need to study 100 pages for that. I hope it does make sense and it does help you. Thank you so much.